I'm Dr. John Weaver. I'm the Program Director for the HCA General Surgery Residency Program here at Sky Ridge Medical Center. Sky Ridge Medical Center is located about 15 miles south of downtown Denver in Lone Tree, Colorado. Sky Ridge Medical Center is a 284-bed hospital with 30 ORs. The catchment area for our hospital is about 1.5 million people, which provides ample patients to treat in this facility. Sky Ridge Medical Center is also a bariatric center of excellence. We are the largest spine and joint center in the state of Colorado. We are one of the largest robotic programs in the state of Colorado as well. We have a fully functioning wound care center with a hyperbaric chamber that our residents have the opportunity to work through. Being a community program, we take 3 residents per year. Some of the highlights of our residency program include the diversity of our rotations. We have access to rotations throughout the Denver metro area. We have access to level 1 and level 2 trauma centers that you'll rotate through your entire residency. We have multiple transplant rotations. We have dedicated robotic rotations and an entire robotic curriculum for our residents. We have dedicated breast surgery rotations and colorectal surgery rotations as well, just to name a few.
Hi, my name is Joy Hume from Sky Ridge Medical Center, Director of Surgical Services. This is Shelby, our anesthesia tech lead, Ryan, one of our service line tech leads, and Christy, our unit coordinator. Here at Sky Ridge, we have many service lines and new doctors coming on to give the residents the best education and training that they need. Here at Sky Ridge, we love residents.
Hello, my name is Kirk McCarty and I'm the CEO of Sky Ridge Medical Center, and I just wanted to take a minute to tell you what the residency means to us. Over the last 5 years, our residency has grown in a phenomenal way. We've moved from a level 3 trauma to a level 2 trauma that the residents have got to be a part of. The residents have truly become a part of our culture within the hospital. Physicians want them here, the nurses want them here, and as the CEO, I want them here because I think it elevates the care and it improves the things we do every day.
I decided to come to Sky Ridge Medical Center for my residency because I was looking for a community-based program, and that was one of the things that this program provided. I wanted a center that was going to give me a high volume of general elective surgery exposure. What I like most about the residency program now as a PGY5 is definitely the robotics training that has been provided by this program. I think it's one of our strongest assets here at Sky Ridge.
Sky Ridge Hospital does 1,100 robotics cases a year, and we're the robotic leader in the Denver metro area. Fellowship programs and general surgery jobs that you're going to be looking for after you finish the program are all looking for a robust robotic experience, and that's what we've tried to give you here at Sky Ridge in our program. Our robotics program here is designed to get you started and comfortable with the robot from day one. We get our interns fully engaged in online learning, doing video modules and trainings to help you understand all the different aspects of the platform. We bring in the Da Vinci reps to the OR during your first year to bring you through an orientation, a hands-on orientation about how to use the robot, how to use the bedside trainer, the console, and all the other parts of the system. And then we get you assisting on the robot in your first year so that you feel comfortable with how to take care of the patient at the bedside. As you progress through the program, you spend more and more time on the console, operating with the attendings. At multiple facilities, we have 2 consoles so that you and the attending can both be operating together, handing instruments back and forth when appropriate. We have a training console here so that you can prepare yourself for your operative time by going through modules and really honing those operative skills before you step into the OR.
We're now in the hybrid room at Sky Ridge. This is one of 4 hospitals we go for our vascular rotation. We actually work with 2 different groups and 7 different attendings. This room was built in 2017 and it was a $4 million project. It actually brought our vascular volume at Sky Ridge from 30 to 300 in a year. This room is also a multi-systems trauma room. So if we have a major trauma that we need to resuscitate in the operating room, we can bring them here and resuscitate them.
We
enjoy working with the residents. We've been able to integrate them well into the program. We usually have a mid-level or junior level and a senior level or a chief resident on service, and it is very much a graduated experience where as the lower level resident, you're assisting in the laparoscopic and robotic cases. You are doing a lot of the benign anal rectal procedures at the surgery center, and that's when we try to get you as much of the endoscopy as possible, because what I really want is for when you come back as a senior level and a chief, we actually get you time on the console doing advanced laparoscopic robotic surgery. Really what I almost consider fellowship level cases. You get to work at the console with us on our big robotic cases. We've worked with not only in Sky Ridge but our sister hospitals to really expand the resident experience to make sure that you get a good wide variety of general surgery, and then also seeing a lot of different things so that you can make a decision as far as where you want to go after residency. And I think we are getting a good broad training here that we can utilize to get people good jobs.
We also have a significant amount of scholarly activity for our residents and for our faculty. We have 100% involvement of our residents in scholarly activity, which includes research papers, case presentations, conference presentations, and helping to create conferences. Our residents are also actively involved in weekly didactics, both presented by residents and our faculty. We have weekly M&M conferences, we have grand rounds, and we have weekly journal club as well.
So, we have a really strong research program even though we are not an academic center. And one of the reasons is that we're an HCA hospital. HCA actually allows you access to their national database. So they have, I think it's around 184 hospitals that anytime you want to do a research project, you get to pull from. So you can do a multi-center study retrospective anytime you want. So if you think of an idea, we'll help you do it here. We meet monthly with our research director. We have about 14 ongoing projects right now and 2 QI projects.
The other thing that I really liked about the program is the size of the program and how committed and devoted some of our faculty members are.
Like all of our attendings, I feel like they're very approachable. You see them every single year. They, get you into the operating room really early, which I love.
The thing I like about being involved with resident education is frequently they educate me. They keep me on my toes and make sure that I'm keeping up with the literature and not just growing old and doing things that I've been doing for years and years just because that's the way I was taught. And as the program has evolved, so has the role of the residents evolved as well as part of our trauma program. And I would say they really are a very important part of that program.
I chose Sky Ridge for a couple of reasons. So one thing that was extremely important to me was having a good balance between a personal and professional lifestyle. So one of the things that I really liked is at that time there was only one class ahead of us and a lot of them were married or have kids. So talking to them and realizing that they still have plenty of time during their week or month to spend times with their family and still be available for their personal needs was something that really struck me. You don't see that a whole lot in a lot of other residency programs.
When I came to interview here, one of the reasons I applied is I really liked the idea of going to a small community program that wasn't, a big academic center or anything like that where I feel like people can get lost. But the other big thing that I've loved since I've been here has really been the camaraderie of everybody in my residency program. I think we all get along really well. I think we support each other extremely well. And I think that goes a long way because surgery residency is tough. So having people that you can lean on and who know what you're going through has been super helpful.
On behalf of the HCA General Surgery Residency Program here at Sky Ridge Medical Center, we'd like to thank you for taking the time to watch the video. We hope you found it truly informative. We hope you got a glimpse of the amazing facilities we have here at Sky Ridge Medical Center. If you have any questions for our program, please feel free to reach out to us directly. We hope to see you next year.